So, obviously, I forgot the mouth structures. Obviously, the cheek is pretty self-evident. The gingiva are the proper names for the gums. And so when we can stretch the lip out here a little bit and we can see the gums surrounding the teeth, that is going to be the gingiva. The hard palate, again, is the anterior portion of the mouth. Soft palate, posterior portion of the mouth. Obviously the lip, oral cavity, and esophagus there. We did body, fundus, pyloric, cardiac region, pyloric sphincter, small intestine, ascending colon, descending colon, duodenum, ileum, jejunum, transverse colon, sphincter. So we got all those. Nothing in teeth. Oh, dental formula and types of teeth. When we look at the types of teeth, the incisors are going to be medial and lateral. They're going to be the first front teeth. Then the canine or cuspid. We have one little tiny premolar in here, and then the molars posterior to that. When we talk about the differences in evolution of organisms, one of the things that you can see as we look at the cat's teeth, even their molars are sharp and pointy. They are carnivores under normal circumstances. So their teeth are all there to cut and tear meat versus our teeth, which have evolved for some grinding. All right. And we got apex and body of tongue. We did the pancreas, the liver, including the lobes, the gallbladder, hepatic duct, hepatic artery, hepatic vein, and hepatic portal. I knew I was missing something. So the hepatic artery and vein are going to be superior to the liver here. So they are going to enter in at the right medial lobe. And so we can see the hepatic vein very clearly here, the big blue vein there. The hepatic artery is actually going to come in. It starts superior and then comes underneath here in between the lobes. And so we can see the red artery there. And then the hepatic portal vein is the one that joins together the superior mesenteric vein, the splenic vein, the gastric vein, and others. And so where these, we can see the vein coming from the small intestine here, and we can see the vein coming over through the omentum from the spleen. Neither of them are stained because they're not part of systemic circulation. They're a special circulatory path. So those two vessels join together to form this kind of T-shaped vessel here. You can see the vessel, one part of the T coming there, the other part coming up from there. Where they join together here is going to be the hepatic portal vein. So this portion over here is hepatic portal vein. So the liver, everything that we absorb from our food, the liver essentially screens before it's sent into general circulation. So hepatic portal, hepatic. So I think that gets the cat list. So while we're here, to kind of hit the highlights again as reminders, the other structures we were looking at in the cat are the respiratory, reproductive, and urinary systems. Again, the respiratory system, we talk about the hard palate and soft palate and the oral cavity. Then our next major structure is the larynx here. The larynx begins at the hyoid bone, which is that very small bone that you hear me tinking there. Then the thyroid cartilage, which is the larger and softer cartilage.